Hello, my name is Dr. Michael Thorpy. I'm pleased to summarize the results of a phase 3 clinical study of lower sodium oxybate, LXB, in adults with idiopathic hypersomnia. Idiopathic hypersomnia is a neurologic sleep disorder that causes excessive daytime sleepiness, severe sleep inertia, cognitive impairment, and prolonged nocturnal sleep in many patients. Lower sodium oxybate was approved in the US for the treatment of adults with idiopathic hypersomnia based on the results of a phase 3 clinical study. In the phase 3 study, 154 participants initiated LXB treatment and could titrate their dose if needed for 10 to 14 weeks. Once an optimal dose was achieved during the open label titration and optimization period, it was maintained for 2 weeks during the stable dose period. During the randomized withdrawal period, participants who continued taking LXB showed stable efficacy, while those who withdrew to placebo showed worsening of symptoms. In this analysis, we evaluated the efficacy and safety of LXB treatment during the open label titration and optimization and stable dose periods of the same phase 3 study. In participants who were treatment naive or taking alerting agents, scores on the Epworth Sleepiness Scale decreased by week 1 and continued to decrease into the normal range throughout the open label titration and stable dose periods. A similar trend was observed on the Idiopathic Hypersomnia Severity Scale. These decreases were observed in participants both with and without long sleep time. At baseline, the most severe impairments were seen on the IHSS items relating to feelings of not having slept enough and the impact of hypersomnolence on general health and intellectual functioning. Scores on these items showed strong improvement by the end of the titration and stable dose periods. After 1 week of LXB treatment prior to dose optimization, 53% of participants reported that their global symptoms were improved. Once participants were on an optimal stable dose, 96% reported improvement. Participants reported improved daily functioning on the Functional Outcomes of Sleep Questionnaire short form, the FOSQ-10. Work productivity also showed improvement from baseline as measured by the WPAI SHP. The incidence of treatment-emergent adverse events declined over time as participants titrated to their optimal dose. The most common were nausea, headache, dizziness, and dry mouth. In conclusion, open-label lower sodium oxybate treatment in adults with idiopathic hypersomnia led to clinically meaningful improvements in their symptoms and quality of life. The incidence of adverse events declined over LXB titration and optimization periods.